We're now joined by two very prominent healthcare leaders in the state. Eva Turbiner is President and CEO of Zufall Health Center, and Joan Quigley is President and CEO of North Hudson Community Action Corporation and a former member of the state legislature. I want to thank both of you for joining us. Joan, let me start with you. Both of you are FQHC's federally qualified healthcare centers, correct?
That's correct.
What is the role of a federally qualified healthcare center as we tape this program on the 13th of January moving forward as it relates to vaccine distribution and educating people?
Well, for the last 8 to 10 months, we've been testing people and finding an awful lot with COVID. So now, thank God, we have the vaccines. We are ready to vaccinate people. We started in the very beginning 2 weeks ago with healthcare workers. Now we're doing cops and firemen. And thank God the governor declared today that we can now do senior citizens and people with comorbidities. We have the vaccines, we have the staff, we're ready to go.
You know, so Eva, as Joan lays this out, again, this will be seen in later January, February into March. Where would we need to be, in your opinion? I just asked Commissioner Persicelli the same question. Say it's April 1st. Where should we be as it relates to vaccine distribution, in your opinion?
Well, we're hoping that we can be well through the seniors, well through the folks who live in congregate settings, which means the homeless shelters and some of the public housing situations. We are hoping by April we can get through a large portion of folks. But I think to your question about FQHCs, our role is not necessarily to do the general public. Our role is to focus on people who are typically underserved and typically at the end of the line for things like vaccines. So I think it's our goal, certainly for Zufall, and I assume for most of the health centers, to make sure that the 600,000 people that we care for every year are getting access to the vaccines in a timely basis.
Well said. Joan, let me ask you this. Underserved community, disproportionately black and brown. To the Black and Hispanic community, and there are pockets of resistance to the vaccine everywhere, but there are certain specific, unique challenges in these communities. What is the message that you would share with African Americans, Hispanic Americans who have questions about this vaccine because of the accurate historical taking advantage of, if you will, of minority communities by the government as it relates to healthcare and vaccines?
I think we have an obligation to get ourselves vaccinated first and to serve as role models for them. And then it's going to take time. It's going to take trust, Steve, because when they see that their neighbors and their friends are vaccinated, they're healthier, very few, if any, side effects, then they're going to believe. And that's when we're going to get the rush of all those people who want us to vaccinate them. And we're ready to do that. They trust us now with their overall health. They can certainly trust us to protect them against COVID.
Eva, jump in on that, because it's one thing to say this is where we are on January 13th, but my hope and prayer is that as more people get vaccinated and the side effects are not what people fear those side effects will be, that the resistance will subside significantly. Eva, you say?
Yes, I agree. I think that we see it among our staff. Initially, only about half the staff seemed willing to take the vaccine. As they've watched their colleagues come through, they're more and more stepping up to get their vaccinations. And we are putting that message out in the community. So we do believe that people are not necessarily anti-vaccination. They just wanted to wait a little while and see how the first ones of us did. And we have in particular made sure that our physician leaders and our staff, who are mainly people of color who come from the communities that we serve, we make sure that they were visibly wearing their pins that said, "I got COVID vaccine," so that they could discuss their experience with everyone else.
Well said. Joan, let me ask you, 6 months from when we do this program, 3 to 6 months, will masks, in your opinion, wearing our face masks, will in fact, in your opinion, will it still be a significant part of our lives?
I think it will be for a while until we reach that herd immunity point. I am so sick of masks, but I have a whole array of pretty of them, and I think many people do. So I think we'll be wearing them. We'll get used to it. I'm worried about some of the younger people lacking trust in the vaccines. They're worried about fertility. They want to see a year from now whether or not there's that kind of side effect.
We'll talk about that, because I actually had a friend, they have daughters who are thinking about wanting to have children at some point. And our friend, our very close friend, said, well, no way I'm letting my daughter do that, because I think there's an effect. It's potentially, we don't know if it has an impact on fertility. Do we know, first, Joan, do we know that it does not or does? What do we know?
We don't know enough to be absolutely certain. There've been no reports of that kind of effect. But then again, the vaccines have only been given out for a short period of time. So we're going to have to check and make sure over time that there's no such problem.
Got it. By the way, I want to make it clear, our producers are putting in our chat that both of you are board members of the New Jersey Primary Care Association, a very important healthcare association. Let me ask you this. Yeah, Eva, let me ask you this. Joan's made a great point in the time we have left, that it's only been a certain period of time. Yes, you can call it warp speed, and yes, we're thrilled that the vaccine is out, but as Joan said, we don't know longer term. What do you say to folks who say, yeah, I haven't seen any negative reactions, but we don't know long term? What do you say to those folks, Eva?
Well, I think these particular vaccines are relatively new. The technology that they are based on has been out for quite some time. And so we do believe that these vaccines are safe and they've been shown to be effective. So we are certainly heavily promoting them. And I would like to make a mention about masks. They have been effective against COVID, but also we're seeing virtually no flu this year in New Jersey. And I'm absolutely positive it is because we are all wearing masks, we are all socially distanced, we are all washing our hands, and the impact it has had on other contagious diseases is really quite remarkable. This year, we just no flu whatsoever.
Let's not take that for granted. Eva Turbiner, and Joan Quigley, I want to thank you so much for joining us, and the work that you're doing every day is clearly making a difference, particularly in underserved communities. Thank you both very much. Stay safe and be well. Thank you.
Thank you.
I'm Steve Adubato. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, Delta Dental of New Jersey, NJM Insurance Group, New Jersey Sharing Network, the Robert Wood Johnson Foundation, the North Ward Center, the Russell Berry Foundation, Rutgers University, Newark, and by United Airlines. Promotional support provided by Meadowlands Chamber and by bestofnj.com.
Right now, 6 feet can feel like a long ways away. But from 6 feet, we can still smile at each other. From our doorways and our stairways, from opposite sides of the street and opposite sides of the country. Through fear and frustrations, we can remind each other that we are still here for each other. Because we can still smile at each other, and we're not going anywhere.